this is Dr. Yi, your host. If you are considering weight loss through medication, then look no further. I have an answer for you for every single medication that is available out there in the market. Like many physicians out there, I won't recommend that you first start with diet and exercise before you jump into medication. However, that might not be possible for you, whether you have life going on, you might not be regular with your diet and exercise and it's just impossible for you, or if you just simply aren't reaching the goal that you want to keep your body healthy. In those cases, I recommend medication. And let's look at what kind of medication there are out there. So who should be taking these medication? Anyone with BMI of above 30 is automatically go. So meaning you have the right to take this medication, your doctor will most likely prescribe you these medication. However, they also recommend that anyone with BMI of 27 and any health conditions such as diabetes, high blood pressure, high cholesterol, these people are a good candidate to go on these medication. And I want to remind everyone that diet pill is not an answer to obesity, meaning that just because you take this pill, all of a sudden you lose weight and you don't need to take any more medication in the future. Just like diabetes medication and high blood pressure medication, you have to be on these medications consistently and be monitored by your physicians. Let's first talk about the most popular medication out there in the market. It's called Orlistat. Orlistat, basically the mechanism behind it is that it's stopping the lipase production from the pancreas. Lipase is important to break down and absorb fat, and if you aren't able to absorb these fat, can you imagine what you're pooping out? Yes, you're pooping out fat. With Orlistat, you can expect somewhere between 10 to 20 pound weight loss. And the side effect, just because you're pooping out all these lipids, yes, you're going to have a lot of abdominal cramps. Also, you're going to have a vitamin deficiency. Some of the vitamins out there are absorbed through fat. And if we aren't able to absorb fat by taking this medication, then we can expect some vitamin deficiency. Next medication is something called Liraglutide. This is a diabetic medication that is also helpful for an individual to lose weight. And how it works is it basically plays with your blood glucose level in order to help you lose weight. You can expect anywhere from 10 to 15 pound weight loss, not as big as Orlistat. And the side effect of the medication includes nausea, vomiting, diarrhea, as well as low blood glucose level. And the one downfall with Liraglutide is that it is only used in the injection form. There are some companies out there that is developing some oral form where you just take the medication, but that is unfortunately not in the market as of now. Next medication I'll be talking about is called Kasserine. Kasserine is a medication that uses serotonin in our body in order to lose weight. With this, you can expect anywhere from 9 to 15 pounds weight loss based on the research. However, there's a lot of side effects such as like upper respiratory infection, as well as headache, nausea. So it's not as popular as other medication. The next class of drug I want to talk about is sympathomimetic drugs, and these include phentermine, benzathymine, and the list goes on. However, the most popular is phentermine. The reason why this is so effective is because it plays with your heart rate as well as your blood vessels, so it's very, very effective in terms of losing weight, and you can lose anywhere from 15 to 25 pounds weight loss. 25-pound weight loss. And the important thing about this drug is it should be used in short term. So they recommend short-term usage, about 12-week usage period. And like I talked about earlier, the side effects include cardiovascular risk, high blood pressure, fast heart rate, and the list goes on. So it needs to be closely followed by a doctor. And there's many combination drugs out there in the market that has been proven that it is very effective, such as phentermine and topiramate combination works great, as well as bupropion and naltrexone. And one of the drugs I wanted to talk about was bupropion and naltrexone. Bupropion and naltrexone has been shown that it is very effective in losing weight, as well as help you quit smoking. So if you're concerned that you might gain weight because you quit smoking, then this is a perfect drug for you because it not only helps you lose weight, but it also helps you quit smoking as well. I hope today's topic was somewhat useful for you and not too dry. I know it was a lot of list of things to tell you and side effects and whatnot, but I hope this was somewhat helpful. And next week's topic is basically Diet 101. If you've never been on a diet and if you've never tried dieting and you don't know where to start, next week is when I will unleash all the secrets.